forward to welcoming you to our hospital's international courses.
We are delighted to launch the first international educational program series at Imam Reza General Hospital, Tabriz, Iran.
Tabriz is a historical and vibrant city.
You will love our beloved city.
Join us for our educational programs.
We'd love to have you here.
Waiting for nice days together.
See you soon!
Hello everybody, ladies and gentlemen. We are here with another conversation from the series of conversations with our university professors. Today, I'm pleased to host my boss, my head of department, Dr. Sakineh Hajebrahimi, to introduce two different courses she is providing with our other colleagues. She will explain more about the course. Very happy to have you here, Professor Hajebrahimi. Would you please explain yourself, introduce yourself first, and the field of activity?
Yes, sure. Thank you very much for the opportunity. My name is Sakineh Hajebrahimi. I'm professor of urology, and currently I'm chair of the Department of Urology in Tabriz University of Medical Science. In addition to my work in the university, I'm president of Iranian Female and Functional Society and Research Center for Evidence-Based Medicine in Tabriz University of Medical Science.
Okay, thank you. You have several responsibilities.
This is part of those.
Yeah, of course. First of all, I would like you to explain about the department and what are the activities and what is your daily practice, your team, I mean the department. Because I think it will help to explain the atmosphere and the content of your course.
Yeah. Actually, I would like to start from the history of medicine in our area. And we have an amazing history of multidisciplinary work in our province. And we have Rabbi Rashidi, the most famous multicentric medical center in the 16th century. In addition to that, we have Avicenna, who explains some of lower urinary tract symptoms and urological disorders more than 1,000 years ago. So having this great background make us very powerful to have a good opportunity to in this field. So our department almost founded more than 50 years ago, almost. And actually before that, we was part of general surgery department. And then during the years, urology divided from the general urology. We have very big and famous professors like Professor Mojid Molavi, Professor Tabakkoli, and then for the modern urology, actually we have pioneers like Professor Tabakkoli and Professor Madain. After Professor Madayan, actually, the modern department of urology developed more and more during the last 40 years, I think. And nowadays, we are one of the best and multidisciplinary departments in Iran, and I think in the region. We have a general urology service like medical, non-medical, invasive, non-invasive procedures in the field of endourology, endourology, and pediatric urology, female and functional urology, reconstructive surgery. And in addition to all these things, we have transplant and kidney transplant responsibility is with our department. And for this reason, I think our department is one of the best. And the thing that I forget to say, our great uro-oncology departments, which have good service for whole northwest of Iran. And we are trying to empower ourselves and provide a good educational courses and good care services for all patients.
Good, very good, great. Very wide background, and coming down to what we are going to talk specifically today. Would you explain the courses, and you selected to talk about both of two courses in one video program. So you will introduce both of the courses. Would you please start with one of them with your own
for sure.
preference?
For both of those, we have a background that I have to talk about that background first, and then I will explain both of those courses. The female and functional urology is a new approach and a new area in whole world. And we started this session in our department in almost 2003, after my graduation from the Jewish General Hospital of McGill University in Canada. And then we try to empower ourselves not only in female urology, but also in functional urology, neurourology, urodynamics, reconstructive surgery, female and male, and some reconstructive and cosmetic surgeries like intersex, transex, and something like that. So it's a very wide, field, and for this reason, we decided to just divide courses in this field. For example, for female and functional urology, for urodynamics, or neurourology separately. So what is make our courses different is an excellent multidisciplinary team. We have not only urologists and female urologists, functional urologists like me and Dr. Elham Jahantabi. We have a good gynecology team like Dr. Bostani and Dr. Malla, and physiotherapy like Dr. Qaderi, and colorectal surgeons are helping us in this field. And we have a good team for regenerative sciences and transitional research that Dr. Saleh is helping us in this field. So I think this part of work makes our department very special. So I'm proud to say that almost all medical, non-medical, non-invasive and invasive procedures in the field of female and functional urologists are almost available in our center. We are focusing on lower urinary tract symptoms and urinary incontinence and all reconstructive surgeries in pelvic, and with your help we are doing some reconstructive surgeries even for intersex or transsex patients. And in addition to this, we have good activities for caring neurourological patients, and we have a great urodynamic unit with whole equipment and services, and we have some intervention for such patients like sacral neuromodulations and bulking agent and any other even more invasive procedures like cystoplasty, augmentation, and many other things.
Very great, a wide variety of techniques.
Exactly.
And as far as I understand, I am also one of your team members.
For sure.
Oh, great. Thank you. Okay.
You're milestone of our team in reconstructive surgery, especially in male reconstructive for male urinary incontinence, like post-prostatectomy incontinence, sphincter, and a sling procedure, and we are always together.
Proud of that.
Thank you.
Would you please exactly name the names of two courses for a more clear, understanding of the titles of the courses, please?
Actually,
and also you can explain how is the duration of each of the courses, and is it flexible? Can be further on or shorter course? And also the eligibility criteria. Who is eligible for the course?
Actually, we have a course for urodynamic studies, and during this course, all participants can be hands-on to do urodynamic studies for all the patient and the techniques and any interventions in this field, and they can just have any kind of interpretation of the urodynamic studies and different definition of lower urinary tract symptoms and regarding the urodynamic studies. All urologists and even gynecologists are eligible to participate in this field, and if someone at all would like to see a large amount of the cases in the biggest referral center of northwest of Iran in very short time, this is the place he or she can join us. Actually, for people who are living in developed countries, we have so many cases they have never
so many strange cases.
Many strange cases, many complicated cases like genitourinary fistula or very huge prolapse surgeries, or even for intersex patients that we have very older patients with intersex, and still we wanted to do some surgery for those patients. And for people who are living in developing countries, they can feel how can they manage their patients that they visited every day, but they couldn't know how can help them and how can support those patients. So maybe it's surprising for some of our audience. Actually, we have at least, I think, 20 or 25 procedures per week in the field of female functional and reconstructive surgery. And so it's a very good field to be hand-on and understand what can we do for those patients. For the second course is about the female functional urology. Mostly we focus on urinary incontinence, and people can have a good experience in different types of urinary incontinence, like stress urinary incontinence or active bladder syndrome, and even the true incontinence like fistula and other
anomalies,
everything. And the course can be, we are very flexible, between 3 months to 6 months. Even some of our participants like to continue their fellowship in here, and I think they can make a decision after, just visiting our department and see these opportunities.
Great. You are always great at explaining what you are going to describe. In a short sense, I would ask you again, what makes this course different or superior, maybe, compared to other similar courses available in other parts of the world? You talked about the key points and positive features, but if very short, you can explain the priority of coming in your department, what would you say?
First of all, we have a very polite field and a multidisciplinary team. They are all friends of each other. The second thing that makes our department very unique is our collaboration with Research Center for Evidence-Based Medicine and Research Center for stem cells. Because we can do some research projects for regenerative medicine in our department. And in evidence-based center, all fellows can understand what is the process of a systematic review, how they can develop or read a guideline or a systematic review, and even they can involve in some of our international randomized controlled trials. So these are all makes our center and our educations very unique.
Great. So it is also another feature you talked about, and it would be attractive for our colleagues that continue the course, a clinical course. In the meantime, they can continue their publication skills, making that better. Great. At the end of our conversation, if there is anything that you want to add to what we talked about, we are here to.
I would like to thank again for the opportunity, and I would like to invite all doctors or fellows who would like to have a good view and good understanding about lower urinary tract symptoms, about function and dysfunction. All are welcome to our department and our university, and I'm sure they will enjoy.
Great, thank you. It was a great pleasure for me to have Dr. Sakineh Hajebrahimi here, my head of department and one of the unique authorities in our university. It was a great day for me to be with her and talk about 2 different courses provided by her and her colleagues' teams. If you have any other questions, more information needed, please contact us, our expert team, or visit our website. And thank you for watching.